Hey guys, Curtis Alexander. In this video, let's talk about SIBO, small intestinal bacterial overgrowth. We had a question recently from a viewer basically going, are there some practical things I can do, home remedies, that sort of thing? There are, and I'm going to talk about those in this video. But before we do that, kind of have to understand, what's going on. So this is kind of a breakdown. If I had SIBO, this is how I think about it. So first of all, your number one concern is endotoxin. Now, what's endotoxin? Basically, that's when bacteria die. It's kind of these toxins that they throw off. It's always going to be present, but you don't want it to get overwhelming when that happens. Endotoxins are very, very inflammatory. So at some point, when it gets bad enough, it's going to cross the barrier. You're going to have that leaky gut. You're also going to have the endotoxins migrating up to the small intestine. Now, why is that important? Because your small intestine is supposed to be basically have no bacteria. It's supposed to be clean. That's why having daily 1 to 3 times a day bowel movements is so important. We want to keep your GI tract clean. So the small intestine needs to be clean. No bacteria, but when the bacteria get in there, we start to have this overgrowth. Okay, so another bad thing about getting these bacteria, they get into the intestine and you can have things like dental problems. You can have an increased risk of cancer, pancreatitis, fatty liver, fibrosis of the organs, acne. Anytime somebody comes to me with skin problems, it's almost always a gut issue. Okay, so we know that these toxins in your small intestine are not good. The question becomes, what's causing it? Well, first of all, I see this a lot in people who have a low thyroid. It means you have a low stomach acid. Generally speaking, they're constipated in a lot of cases. When you have low stomach acid, you're not killing some of these bacteria in the upper part of the intestinal tract, which includes the stomach, the small intestine. So basically, we want to keep the gut clean. That's our main goal. So what can we do to do that? Well, you go to the doctor. You can get something like Xifaxan. It's an off-label use for SIBO, meaning it's not supposed to be used for that, but you'll see it. And the basic idea is it's basically a non-digestible antibiotic, meaning it can get through the whole intestine and kind of wipe out that stuff. But that can come with a number of problems, side effects, cost, and those sorts of things. So natural things we can do. The first thing I would look at is taking aspirin. Now, you may want to take aspirin with vitamin K2, because aspirin, can increase your risk of bleeding. K2 helps lower that. So there's kind of a balance there that you have to keep. But that's the first thing I would do. Aspirin is a good antiseptic. It's very good in the stomach and small intestine. It generally doesn't make it into the colon, but since we're talking about SIBO, it's a very good option. If you wanted to go farther down into the intestinal tract, there are options for that. But since we're just talking about the small intestine, aspirin is a great option. You may want to take that with K2. The other thing that I would focus on is eating some insoluble fibers. For example, I think raw carrot, that's what I prefer. The raw carrot, bamboo shoots, mushrooms, cooked mushrooms, they're insoluble fiber. They will make their way through your digestive tract. And basically, they kind of act like sweeping your intestine, kind of clean some of those out. They'll even clean out biofilms. Biofilms are like kind of these bacterial colonies that can kind of take up a residence in your intestinal tract. So eating raw carrots, that's a great option. The other thing is coconut oil. Coconut oil is a potent antibacterial. It does get absorbed early. So there is some that gets into your small intestine. Again, if it's something more with colon issues, it wouldn't be the best option. But another good option you could try is mixing aspirin with coconut oil and insoluble fiber like carrots. But again, the big three are, I would get insoluble fiber form of carrots, mushrooms, bamboo shoots. I would get aspirin, possibly along with K2, depending on your situation. And then I do coconut oil. There's 3 very low cost options. They work well. And then, of course, you have to change your diet and you have to change your lifestyle. But those are good starts. Those would be what I would go after if I had SIBO. So hopefully that's helpful. Let me know in the comments other topics you want me to cover. And hopefully it's helpful, guys. See you in the next one.